We're going to be taking blood pressure today. So make sure that your patient is seated with their feet flat on the ground and they're sitting up nice and tall. Can you take your watch off for me, please? So if you're taking blood pressure on the right-hand side, you're going to be standing there. Take their right hand and cup it with your right arm. Can you roll up your sleeve actually for me, please, and then cover your breast tissue? Thank you. You'll first find on your blood pressure cuff where your artery index marker is. Palpate for the brachial artery. You want to have the blood pressure cuff a couple centimeters or 1.5 inches above the cubital fossa. When you're putting the blood pressure cuff on, make sure that it's sitting nice and flat on the patient's arm and that the marker fits within the range of the artery index marker. If not, you might have to go up or down a size. Put your auricles in your ears facing forward before you start to pump up the blood pressure. And then you can find the pulse either here at the radial or at the brachial artery. So just relax for a moment.
And then you're gonna pump it up once you start to, once you don't hear the pulse, feel the pulse anymore, and then it'll go about 20 or so millimeters of mercury above where you felt it stop. Then you'll put the diaphragm on at the brachial artery, slowly release the air, so about 2 millimeters of mercury per second. And then once you note where you start hearing the pulse, that'll be your systolic. And then keep releasing, and when you hear it disappear, that's going to be your diastolic. And for the test, you're going to be doing the blood pressure on both sides. So make sure the cuff gets deflated all the way in between each.